Welcome to the Lifestyle Medicine Update. I'm Dr. James Meschino. An important study was published in the July 2018 issue of the Journal of Hypertension, which showed that ingesting more omega-3 fats at a younger age is associated with prevention of early onset high blood pressure. So in this study, researchers examined over 2,000 young people, ages 21 to 40 years old, tracking their blood pressure during office visits and also using a 24-hour blood pressure monitoring device to track blood pressure throughout the day. Now, they also drew blood samples to evaluate the omega-3 fat content of their red blood cells, which established their individual omega-3 index. So when examining all the fats present in the red blood cell membrane, if the omega-3 fats comprise 8% of all the fats that are there, then the person is said to have an omega-3 index of 8%. If the omega-3 fats comprised 4% of all the fats in the red blood cell membrane, then the person would have an omega-3 index of 4%. It's really that simple and straightforward. But what's important is that previous studies have shown very compelling evidence that having an omega-3 index of 8% or higher is strongly linked to lower blood pressure in older subjects, as well as decreased risk of many cardiovascular problems, including congestive heart failure, heart attack, and stroke. But the 2018 study now applies to younger people, because the 2018 study has shown that even in younger people, aged 21 to 40, that a higher omega-3 index is associated with a significantly lower risk of having borderline high blood pressure or full-blown high blood pressure at this early stage in life. Now, we know that blood vessels stiffen with aging, which tends to increase the risk of high blood pressure as we get older. But those with a higher omega-3 index at or above 8% seem to have some significant protection against age-related high blood pressure. So how do omega-3 fats help to keep blood pressure in the safer range, which would be below 130/80, more ideally, no higher than 120/70. So in the body, omega-3 fats, the body converts them into these mini hormones called prostaglandin series 3, which open up and relax and dilate blood vessels, making it easier for the blood to flow. So this lowers the resistance to blood flow, which ultimately helps to lower blood pressure. So omega-3 fats are also shown to reduce inflammation, including blood vessel inflammation, which we know is an important factor in preventing cardiovascular disease. And omega-3 fats also help to make the blood a little less sticky, which is an important factor in preventing heart attack, deep vein thrombosis, as well as stroke. So some reviewers point out that consuming 2,000 milligrams a day of omega-3 fats from a combination of fish, which you would have maybe twice a week, along with a daily omega-3 fat supplement, is the most effective way to ensure an omega-3 index at or above 8%. That's where you want to be. Although other factors can affect it to some degree, like gender and age and physical activity, diabetes, body mass index, alcohol consumption, a few other factors, nevertheless, aiming for 2,000 milligrams a day on average is likely a very good guiding principle. Studies show that every 4,000 milligrams of omega-3 fat ingested per month increases your omega-3 index by 0.24%. So month after month it climbs up, and hopefully you get it above 8%. Now, fish that have the highest omega-3 fat content include fish like salmon and pickled herring, bluefish tuna, mackerel, sardines, canned in oil, and steamed oysters. Then there's some fish that have an intermediate amount of omega-3 fat, like swordfish, rainbow trout, sea bass, king crab, tuna canned in water, flatfish. But when looking for an essential fatty acid supplement, I often recommend a supplement that has a combination of fish oil, flaxseed oil, and borage seed oil, 400 milligrams each of those oils all in one capsule. So taking 3 capsules a day would provide 2,400 milligrams of various omega-3 fats like EPA, DHA, and ALA, along with another key fatty acid known as the GLA from borage seed oil, which helps to reduce inflammation and keep your skin smooth and soft. Now, it's important to point out in recent years, the incidence of high blood pressure among younger persons aged 20 to 39 years old has increased from 4% to 19% within the North American population. So years ago, 4% of younger people, 20 to 39 years of age, had high blood pressure. Today, it's 19%. So increasing the omega-3 index appears to be one way to help reverse this trend, along with engagement in regular physical activity or exercise, maintaining an ideal body weight, not smoking, using alcohol judiciously, and in some cases watching sodium intake. As always, I've included the research papers for this information in the text below, so thanks for watching, and I'll see you next time.